and welcome to Chapter 21 lecture, Eye and Ear Disorders. So our learning objectives are explaining the difference between ophthalmic and otic preparations, recognizing ophthalmic and otic medications and their uses, describing drugs used in treatment of ototoxicity and vertigo, describing how to store ophthalmic and otic preparations to prevent their being inadvertently interchanged, and providing patient education for compliance with the medications used to treat the diseases and conditions of the eye and ear. Here we see figure 21.1, and I want you to make sure you take some time in your book and really look at the various parts of the eyes and functions, as well as figure 21.2 in your book of the ear and the various functions. So let's start with the eye. The eye has three layers. The protective external layer has the sclera and cornea. The middle layer has the choroid, the iris, and the ciliary body, and then there's the retina. So miosis, constriction of the pupil, mydriasis, dilation of pupil, accommodation, lens changing shape to adjust for viewing objects at a distance, and presbyopia, inability of lens to accommodate near objects due to lens rigidity caused by aging. Oh, let's go back here. I forgot to ask you. What does the retina contain? The retina contains visual sensory receptors in the form of cones and rods, and the retina is connected by the brain to the optic nerve. Okay, so it connects the brain and it's connected by the optic nerve. So let's talk about what are these things: cataract, cycloplegia, glaucoma. So the cataract is a cloudy lens. So it develops on and in the lens, and it results in the lens losing its transparency. Cycloplegia is the paralysis of the ciliary muscle, and the ciliary muscle contracts to accommodate the eye. So cycloplegia is the paralysis, and therefore it cannot move. What is the function of tears? Why do we have tears, do you think? Great. They wash away irritating agents and are bactericidal, which helps prevent infection in our eye. And then glaucoma is a group of diseases characterized by increased intraocular pressure resulting from excessive production of the aqueous humor or the diminished ocular outflow. So again, things to remember for glaucoma is the increased ocular pressure. So here we're talking about the ear and eye disorders and common symptoms. So as a medical assistant, you are often the first line in terms of patient interaction in the medical office. So patients being seen for different problems might mention some of these symptoms, and they might be unaware that the symptoms could signal a completely different diagnosis that needs additional attention. So it's important to pay attention to some common eye disorders and symptoms. A medical assistant will pick up on them and mention of these items, and they'll evaluate the importance of passing this information on to the physician or the nurse practitioner or whoever is going to be seeing the patient. So let's look at some of those. It would be visual disturbances in the eyes, eye redness, pain and burning in and around the eyeball. And if we're looking at the ears, some of those symptoms would be loss of hearing, vertigo or dizziness, tinnitus, so ringing, and earaches or increased pressure in the ear. So eye medications. What is an ophthalmic preparation? It's a medication specifically formulated for use in the eye. So we also see some side effects caused by these systemic medications. They might be altered color vision, blurred vision, or yellow. There's like a yellow color to the vision, and the yellow color usually comes from the opiates. Here are medication's common side effects for the eyes and ears. So let's start with the ophthalmic. There can be changes in interocular pressure, burning, stinging, pain on administration, blurred vision, photophobia, headache, and increased tears. On the otic side, tinnitus, which again we said was the ringing, burning, itching of ear canal, and dizziness. Medical assistants will often hear complaints about these side effects of this medication, and it's important to listen to those complaints. It's important to be able to define for the patients the common side effects that usually pass quickly and distinguish them from those that should be reported immediately so that the patient leaves knowing and understanding when it's important to call the physician and when maybe a side effect is typical, but it will reduce quickly. Here you see a list of ocular infections and descriptions. These ocular infections are treated with anti-infective and anti-inflammatory agents. To avoid possible sensitization to these agents and discourage drug-resistant strains, the antibiotics prescribed for ophthalmic symptoms is often administered locally, either topically, subconjunctively, or interavally. It's also important to note that prophylactic use of anti-infective agents is not common, and it can actually be potentially dangerous. Here we see some samples of eye conditions. Here on the left, this is acute conjunctivitis. Okay, and this is a stye right here. Have you ever had a stye? I've never had one that badly, but I have had styes on my eye before, and they're not very comfortable. So looking here, anti-infective and anti-inflammatory agents, it's important to note that most states require silver nitrate drops for newborns to prevent the gonococcal infection. During eye irrigation, turn head toward affected side to prevent the cross-contamination. And ophthalmic corticosteroids can have systemic effects if used for a prolonged amount of time. Let's look more closely at glaucoma. So glaucoma is characterized by increased interocular pressure. We talked about that earlier in the slides. 90% of glaucoma patients have open-angle glaucoma, and blindness can occur secondary to the optic nerve damage. We usually see a gradual onset, and it's typically treated with drug therapy. And the aim of this treatment is to decrease the interocular pressure. Here you see an example of the open-angled glaucoma here. Agents for glaucoma include beta blockers, chronolergenic agents or miotics, sympathomimetic agents, carbonic anhydrase inhibitors, prostaglandin agonists, and osmotic diuretics. Drug selection is determined by the ophthalmic requirements to lower pressure and the individual response of each person to the medication. So, what are some potential side effects to these agents? We talked a little bit about blurred vision, myopia, eye irritation, and headaches. You can find in figure 21.4 in your book, and I'm looking to see 21.4, I believe, starts on 375 and goes to 376. And you can find these figures and you can see the different types of agents and the drug names as well as indications and drug interactions. So I want you to make sure that you take a look at those 2 pages more closely and understand, as well as look at some of the drugs for each category. And this just displays the additional page there. Let's look at mydriatics and cycloplegics. Adrenergic agonists mimic pupillary dilation. Cycloplegic agents cause paralysis of the ciliary muscles and prevent accommodation. Over-the-counter adrenergic agonists may cause vasoconstriction, and anticholinergic, I can never say that word, anticholinergic agents cause dilation and are used to reduce inflammation. These are the drugs used during routine eye exams. Both adrenergic agonists and cycloplegic agents are used in the diagnosis of ophthalmologic disorders, and so they're used for different things when doing the eye exam. And again, there is a figure in your book, and I believe that we're looking at figure 21.5, and that can be found on page 377, so you can look more directly at the uses, the major side effects, indications, and drug interactions. Here we are looking at local ophthalmic anesthetic agents, and these are used to eliminate blink reflexes and pain associated with the ophthalmic procedures. They're used for tonometry, for an object removal, suturing, and radial keratotomy. Tonometry is the measurement of the intraocular pressure, or the IOP, that we use to diagnose glaucoma. In table 21.6, you can see the miscellaneous ophthalmic preparations. So why do you think it would be important to protect the eye after administration of the local ophthalmic anesthetic agents? Because the diminished blink reflex then causes it to be a danger, and so the medical assistant must have to emphasize this point with the patient departing. It's important to explain to them that this has been used and that they will have a diminished blink reflex, and to protect and just be aware of their eyes and to try to wear eye protection. And we also usually have them wear some kind of sunglass protection or sun protection for their eyes and lights when they leave the office. Artificial tears and lubricants and the immunomodulators. So these produce eye lubrication when tear production is decreased. Lubricant is artificial eyes, so there's artificial tears for the eyes. It moistens, used to moisten contact lenses, remove debris from the eye. We sometimes use it to have a balance with the normal saline so that we can balance the eye homeostasis. Typically used 3 to 4 times daily. And some of the examples are the Lacrocert or Lacrolube. And the immunomodulators increase tear production. So somebody who is having dry eyes or problem with dry eyes and they're not able to produce the tears, they can use the immunomodulators, and this will help them to increase their tear production. These products are balanced salt solutions or normal saline with agents added to extend the eye contact time. So depending on which solution you're using. Ointment preparations are used to protect the eyes of patients with impaired blink reflexes and in persons who need lubricant at night. Here, we're going to talk about ophthalmic anti-allergic agents and decongestant agents. These are used for allergic eye disorders to prevent tearing, itching, redness, and discharge. They can produce stinging and burning sensation, redness, and even headaches and blurred vision.